Guten Tag, I'm Dr. Richard Miller, and welcome back to Everyday Health Hacks. Today, we are tackling a question I get every single day in my clinic. Doctor, I'm getting older. Isn't a higher blood pressure just normal for my age? The short answer, no. For decades, we've been told that a little high is just part of aging, but science has shifted. Today, we're cutting through the noise to tell you exactly what your numbers should be and why the old 150/90 rule is now a thing of the past. Here is the golden standard for 2026. The major heart organizations now agree, regardless of your age, the target for most adults is under 130/80. Now I hear the protests already, but Richard, my blood vessels are stiffer. Doesn't my heart need that extra pressure to push blood to my brain? That was the old theory, and it was dangerous. We now know that stiff vessels are exactly why we need to keep your pressure managed. Think of your arteries like a garden hose. If you leave that hose under high pressure for years, it eventually cracks, leaks, or bursts. In your body, that burst is a stroke, a heart attack, or cognitive decline. The latest guidelines aren't just about protecting your heart, they are about protecting your brain. Studies now show that keeping that systolic number, the top number below 130, can significantly lower your risk of dementia and cognitive impairment as you age. So, how do we get there? It's rarely about just one pill. It's about synergy. Stop the salt swap myth. Switching to Himalayan or sea salt doesn't help. It's still sodium chloride. The real hack? Read the labels on your bread, canned soups, and condiments. That's where the hidden sodium is hiding. The 2-2-pound rule. You don't need to train for a marathon. Evidence shows that losing just 2.2 pounds can drop your blood pressure by about 1 millimeter of mercury. It sounds small, but when combined with a heart-healthy diet, it can be just as effective as adding a new medication. Home monitoring is non-negotiable. Your office reading is a snapshot. Your home readings tell the story. Use a validated monitor, sit quietly for 5 minutes, and record your numbers. Your doctor needs that data to see if your treatment is actually working, or if you're experiencing white coat hypertension, where your nerves make the numbers jump only when you're in my office. Look, I know the idea of target numbers can feel like pressure, but you aren't just a number on a chart. You are an individual with a unique risk profile. If you are currently sitting at 140 or 150, don't panic and definitely don't just stop your meds because you feel fine. High blood pressure is a silent killer. It rarely gives you a headache or a warning sign until it's too late. Work with your medical team. Be proactive. Aim for that 130/80 goal and keep moving. Your future self will thank you for the work you do today. If you found this helpful, hit that subscribe button. We're here every week with science-backed wellness in 60 seconds. Stay healthy, my friends. Shoes.